Good afternoon. Yes, we're just past noon, and welcome everybody to this AI scribe. Oh, there's some feedback going on. Can everybody hear me? There's a lot of crackling in the background. Don't know if somebody's got their mic on. Just say good afternoon. Welcome everyone to the show and tell a session around AI scribe. I believe it's really an exciting time when AI can make a real positive difference in the way children's neurodivergence assessments are conducted and the impact of their use. In this case, Magic Notes, and we've already seen in the sort of the early findings the sort of real difference it's making not only to clinicians but also in terms of how those clinicians have interacted with families and children during the assessment process. I'm sure that the team will describe, some of the real positive results. Whilst it's early days of the pilot in CTM, the results so far have been really powerful. So I'd really like to thank the team in CTM for their involvement. And now it's over to Kim, Dave and Joe to tell you a little bit more about Magic Notes and AI Scribe. Thanks, Kim.
Thanks, Sally. But just can we just go back to the numbers there, just to reiterate the problem that we have at the moment. So in 2021, you can see there are 4,100 people on the waiting list, and if things carry on the way they're going, it could go up to 61,000 people across Wales, which is absolutely huge. So this is the size of the problem that we're trying to tackle. Can we just go back to the first speak to people slide, Kim? Thanks. So where we wanted to start with this, and we've got the clinicians from CumTAF here today, so thanks for everyone for involvement in this and really helping us. But we wanted to start with speaking to the people doing the work. We wanted to understand what was the pathway, the neurodivergent pathway from end to end. And why was there sort of like blockages in this pathway? What was stopping us getting through all the appointments, and why was that waiting list going down? So we're lucky enough to speak to 6 out of the 7 health boards, to various clinicians, paediatricians, to admin, and we built a picture of what it would look like across this pathway from the awareness of I might be neurodivergent to living with the diagnosis and everything in between. So it's a bit small that if you can't see that, but we'll go into a little bit of the detail we found with this. So one of the things in one particular health board we found there was a lot of different systems and places where data was kept, and we were looking at this at first from an angle of what would happen if we added a new digital system to this ecosystem. And along with the mandatory systems like Care Partner and Welsh PAS that some of the health boards has, we felt like that if we added a new digital system on top of these, it would mean more data redundancy. It'd mean I have to copy and paste to another system, and it would add, not remove, the admin burden from clinicians. So we sort of pivoted away from that. We wanted to see how we could acknowledge this complexity that was there in this pathway and all the systems that we use, but how could we add efficiency to that? Where were the blockages? Where were the pain points? And where could we make a real difference to this pathway? And really importantly, we could see by those numbers that the waiting list was going up and up and up over time. Every week it goes up. So we wanted to do something impactful now that started making a difference really quickly for those teams working in this every day. We started to break that huge pathway down into basic tasks about what could we make efficiency. There were so many tasks along there, but we grouped them into 3 broad areas.
Has Dave frozen?
Yeah, he has.
Or hopefully just temporarily.
There we are.
Sorry.
He's back.
Yeah, sorry, I just cut off for a minute then. And one thing that stood out for us with admin, there was so much admin. One clinician told us that 10 years ago, 80% of her time was spent with the children, and where she feels like she could perceive to add real value by helping those families get through this assessment in this tricky time. And she was spending 20% on admin. Fast forward to today, she's 80% admin and 20% with the child. So it's really changed over the past 10 years or so, the amount of time that people are having to do admin. So the three basic tasks that we pulled together by grouping those tasks along that pathway was there was a challenge of pulling information together from different sources. So from parents requesting information, from schools, from referrals, getting all that information, which sometimes it could be an image, it could be a Word document, a PDF, getting all that, copying and pasting and summarizing that into a document. So this was one of the basic needs. Another one was taking the notes from someone, to go back to the last slide, sorry, Kim, was to take notes in an assessment. So when there's a child and a family there, they're all talking, often it can be noisy, the parent or carer might be talking to multiple children or siblings, and there's lots of name switching and lots of context, and it's a huge cognitive load for that clinician to keep up with this. So we wanted something to help in those sessions to help take notes. And then finally, the third broad area was summarizing and writing those reports after that session, often a few weeks after. So I tried to remember what happened in that session, looking at my scribbled notes and summarizing that in a really detailed way to help other professionals. So we knew that AI could help with these basic tasks. We still needed to figure out how and what would work in the ecosystem of the neurodivergent pathway. But we knew it'd never replace what the humans bring, that real clinical expertise, that ethical and judgment and intuition, and that rapport and connection that the clinicians have to build up with the child and the parents, gaining that trust to make a clinical judgment. So we started to look at AI to try and automate some of these tasks, collating the data, and I could we listen to that data and summarize that. And what we came across was the tool which most matched those broad areas of needs was an AI scribe tool. One in particular that we began testing was Magic Notes. And Magic Notes, what it does, it pulls all either the information as like the images or the Word documents, the PDFs, and it can pull that into the scribe, put it into a template, and then push out a report. But it can also listen in those in-person sessions, pull out the transcript, put that into the scribe and into the template, which then creates a report. So this tool seemed really powerful to us, and it fitted into the journey that we've mapped out. Next slide. And we hypothesized at this point it could potentially save 8 hours, a full day for each clinician every week, which was really powerful. So we wanted to explore this a little more. And we knew that, I think there's a slide missed there, sorry, Kim.
Sorry, I'm being rubbish at this, sorry.
We knew with the NDIT funding, but with clinicians getting paid for overtime and an extra day a week, that the waiting list was finally coming down. So to have that hypothesis that we could save a day a week, and with the NDIT funding perhaps leaving the team we were working with and the waiting list starting to go up again, perhaps this tool could fill a little bit of that gap which that funding left. And we know there's this principle of doing better with what we've got now, not putting more money in it and more people on it, but what can we do more efficiently with whatever we've got now, and how do we improve and make the service more efficient. And when we showed the AI scribe to one of the lead clinicians in the team, just within 10 minutes, they realized that this tool could make a huge difference to their team, which was really, really powerful. But that being good, that it could make a huge difference, we didn't really want to make that assumption that we could just throw AI at this and it would solve the problem. So we wanted to start with some small experiments and a pilot with one team, and I'll pass over to Kim to talk a little bit about that.
Thanks, Dave. I'm just going to jump into the detail of what's been happening since we last spoke at our show and tell. So, you know, as Dave said, there is a lot of talk about AI at the moment. Just to reiterate, we didn't start with that as the answer. We're really conscious that if we're suggesting introducing an AI scribe into clinical work, we really need to prove that it's going to help. And we've talked before in a show and tell about how we've uncovered lots of breaking points of this tool with some really tough simulation testing in Swansea. We know about all those boundaries, but our pilot is so much more than that. It's real people, real sessions, real learning, and every experiment is built on what our clinicians told us they needed the most, which is to have some time back to spend with patients. Cwmtaf as an entire health board have been really brave, and they've stepped forward first for this pilot. So that's not just the ND team who could obviously see the value, but the digital team and the information governance team too. I think we've all broken new ground in getting this pilot up and running, and we really needed to answer this question. So can an AI scribe, like Magic Notes, positively impact this waiting list? Some statistics from this health board: there are around 3,000 children on the list, and there are around 200 new referrals added each month, with 100 to 150 being taken off. So it's really easy to do the maths there and see that that list is growing. So with our pilot, our plan was for 6 weeks for 6 clinicians to use Magic Notes. We would work with some very specific experiments, but we also wanted to give them complete freedom to test anything else that looked like a good idea. And during the pilot, we're running diary studies, and we have a really lively WhatsApp group so that we can be really close to their experiences. We don't just care about the numbers, but we want to understand the emotions, the surprises, and try and support with any problems or barriers that they're experiencing. So we've got some really rich human picture of what's going on, and it's really backed up with some live data from these diary studies. We're about halfway through now. So with our 6 clinicians, we've had about 204 recorded sessions. That's 98 hours of conversations. So you can see we really do have a lot of data. What we've observed is that it's actually really low friction in terms of setup. So there's been no huge amount of training needed. There's been no system integration. It's just something that really works. And what that has been reflected in is the speed of adoption. So I think our clinicians started using it very easily, simply on that very first day. So then what followed is the emotional impact. So the team really are describing this as game changing. We've got dozens of sessions, we've got hours of transcript, and we can really see those tangible time savings after 3 weeks. Sorry, my connection, I think. Can you still see my screen okay, everyone? Yeah. It's really hard in a short presentation like this to describe the impact on the team, but with permission, we've wanted to share this from, I think it was about 3 days in. One clinician said, if we don't get Magic Notes after this pilot, I think I might quit my job. And that is something that you do not hear this quickly. In fact, for anyone else that's been involved in deploying IT systems, can anyone ever remember hearing anything so positive as that? It just shows how quickly it's really making a difference to this team. You know what? This team will tell the story way better than Dave and I can. So we thought that this message was really apt when we discussed together presenting at the show and tell today. The team are really keen to share their experiences. So I think first I'm going to hand to Penny. Is that right? Are you there, Penny?
Yeah, I'm here. Hiya. Can you hear me? Oh, I don't know whether you've gone off. Kim, is that okay? Fab. So I was kind of, I absolutely love Magic Notes, and I absolutely agree that I will also quit my job. No, I'm not, but it's been fabulous. But I think when we kind of started kind of talking about the pilot, it was all about, like Dave said, about what we can do to improve our admin time. What would normally take us maybe 3 to 4, sometimes even 5 hours if it's quite a complex case. Could we bring that down to 1? That would be amazing. And I don't think we really considered at the time how it would change the kind of assessment process. But for me, I think that's where I found the biggest contribution. So if I think about what it was like beforehand, what the room was like, we were job planned, we might have about 90 minutes per case. And sometimes that's just, well, in fact, a lot of the time that just wasn't enough. You want to be able to give these parents and these kids the time. You're very mindful that these parents have been waiting on a waiting list. Well, the kids have been waiting, but with the parents who've been really feeling the real struggles of it all for, sometimes up to 4 or 5 years, the parents have been pushing these things. Even though the waiting list seems shorter, parents have been pushing this for years and they haven't got the school to back. It's been a long, long, long time for them. So you really feel that you want to be able to give them the time that they deserve, really. But trying to balance that up with capturing the data is really difficult. And I would find that I would be running over quite often by 20, 30 minutes per appointment. I'd be working through my lunch hour, I'd be going home, I'd be going onto the laptop, I'd be doing more work, sometimes till kind of 9, 10 at night, sometimes even later. And that's just to try and keep on track of things. The parents then would be getting their reports weeks and weeks and weeks after the appointment. That would cause further delays in terms of adding them to our internal waiting list for the further assessments, the next part of the process. So it was a real bulk of, it was a heavy workload. And although it impacted us as clinicians, massively so, it also had quite a detrimental impact on the families as well. The appointments themselves, they were very fragmented. They felt quite rushed, very stressed. You'd have to put a certain, a pin in certain points. It very much felt like we were trying to just go through a checklist rather than really covering their stories and their experiences. Our time pressures, we felt time pressures as clinicians. We had to focus on trying to get everything written down and typed rather than kind of actively listening and kind of taking on clearer clinical observations. The doctors tell me when they are trying to kind of make decisions, because Cumtaf, I have to give it to Cumtaf, and they really do try and find ways to make the service run much smoother, make the whole diagnostic process much smoother, and ways that they can make changes, they really will. And so the doctors, when they are looking at a lot of our reports, they're telling me that the main thing that they want is about clinical observations. And sometimes my clinical observations, I'll be honest, were rubbish, because I just didn't have the time and the mental space to be actively capturing all the data to put into my report and watching the kid with eyes like the back of my head. So you just couldn't spread yourself thin enough, really. From a clinical point of view as well, in those assessments at that time, they felt very led. So they felt clinician led. So I was kind of having to lead the parents to certain criteria just to make sure that we met the criteria in the questioning. Parents then would look really anxious because they'd be trying to find and fit examples because they know where I was going with it, and they'd want to try and pressurize themselves to find an example, but it wasn't then given a true picture of what their difficulties were really like. And so the whole emotion, the room was just heavy, trying to get everything right, trying to get everything done quickly. It was a lot. But since we've had Magic Notes and using it now to record the conversations, record the assessments, it's massively lightened that load. The conversations flow much more naturally. The parents, the children themselves can speak much more freely. I find that then the parents are able to share their experiences in kind of their own time, in their own words. They're not feeling guided or kind of tested. We're not then trying to slam our way through a checklist really quickly. And their own words then are kind of bringing their stories and the evidence that is needed to light. So the conversations are much more natural, and we're coming to a more natural end within, the proper timeframes, really. I'm not now having to extend my sessions by 20-30 minutes, I'm actually leaving myself with time to offer them signposted information, whereas before I would be saying, oh, I'll pop it on the end of the report because I'm already eating into 20 minutes of my next appointment, you know, so kind of saying, oh, have a read of it now, and it was never, it's all you could do, but it just wasn't enough, and then you kind of carry the guilt with that because you know the parents are just desperate. You know, I'm thinking about the kind of experience of the patient themselves. It's got to feel different because we're more present, we're listening, we're engaging, we're responding to them, rather than having my head in the computer. I mean, I could give you this presentation now, but I could be looking at my computer over here, and this is what they're seeing. They're seeing the corner or the back of my head with very little engagement. You just seem disinterested, but that's not the case. You're just trying to juggle up and weigh everything, and it's a really difficult thing to do. I find now that with the use of magic notes, because the conversation is much clearer, you're naturally seeing whether they're meeting the criteria or not. You're not having to lead them down the garden path to find what fits criteria and what doesn't, because the parents are able to talk. I'm able to rely on the system to capture the data. I'm not kind of going, oh, well, I'll come back to this and I'll chop and change. Because it just captures the data, they're giving me the evidence that I need, or not, because the child doesn't always meet the criteria, but I'm able to see that much more clearer than I would do when I was going up and down in different performers all the time. And the children themselves, then, they get to be themselves. They can play with the toys. In fact, I've had a child this morning that's destroyed almost all of the toys in the room, which has been great. You know, we've been doing star jumps in the room this morning. I'm knackered. But they get to be themselves, and I'm then entering into their world. So I think a couple of examples, I gave an example in one of the previous meetings, was about I played Connect 4 for an entire session. With this one child who came for assessment of autism and ADHD. And the benefit of that was I could ask mum questions and I could have that conversation with mum, but I was really engaging with the young child. So I was getting the data, but I was really seeing a genuine window into how this child communicated, how he focuses, you know, how he manages kind of social interaction outside of that structured question and answer window. I was able to see kind of how he could take turns, how he coped with stress. Could he manage losing? To be fair, he beat me quite a few times, but that wasn't the point. How he was kind of reading social cues with his sustained attention. I was able to see all of that. Whereas before Magic Notes, my face would have been in the computer and I wouldn't have really been paying the attention that is due to the child. So for mum, I'd like to think that from her perspective, she could see that our assessment was thorough. I was genuinely connecting with him. I was, you know, it could build confidence with her into our assessment process, really, and our diagnostic process, because sometimes I imagine parents must feel the conversation is very much one-sided. And this child wasn't then just traits on a checklist. So in terms of another brief one that I had quite a hostile family that came into clinic the other day, and they've been bounced around through services, they've been to CAMS, they've been through social services, never really feeling that they were getting anywhere. CAMS, for example, had declined the referral at the point of an MDT discussion with no real clarity. Nothing had ever been explained. And so the entire assessment then, it felt quite hostile and quite frosty. Before Magic Notes then, I'd have to try and manage that level of hostility, which would have been really difficult because, again, my focus would have been on kind of gathering the data really and trying to keep the detailed notes. And I wouldn't have had the space to really address the difficulties or the emotional tension that they were having. But because Magic Notes took a bulk of that mental load away from me, we were able to have quite a human conversation, and I didn't have my head deep into the computer. So we finished that assessment really early and I was able to give that extra time. I wanted to give them the full 90 minutes. As far as I'm concerned, they're absolutely entitled to all of it. And I was able to kind of correct the misinformation. I was able to look back through the CAMS. I'm fortunate in the fact that I had the CAMS background with the CAMS team. So I was able to really look at how they had been declined for whatever reason, and just explain to them how these services fit in together. You know, I was able to reassure them that actually it's okay. You know, there are other services that might actually meet the needs much better. And then I spent 15 minutes going through different signposting services with them. And because we've kind of covered all of this information within the assessment itself, I was able to relate exactly the different services and how they could meet the needs of their child. I was able to give them, I was writing all of this signposting information down, and they left with something tangible in their hand to go away with and look at, rather than feeling kind of rushed out of the room. And at the end of the appointment, they reported that they felt, well, they said they felt much calmer, things seemed a lot more clearer, and they said it was the best appointment they'd ever had. So I was quite chuffed with that. But Dave made a really good point that ultimately this technology is not going to replace clinicians, but what it does do is it gives us back the time and the focus to kind of really connect with the patients as people. So just a very brief summary then, because I appreciate I'm probably taking up a lot of people's time. Before Magic Notes, every assessment came with pressure. Our time was tight. We were stealing time, essentially, whether we were stealing it from the next appointment, stealing it from our own admin time, stealing it from our families and our personal lives, because we would be doing these hours way over kind of the overtime and kind of what we were really getting paid for. The assessments didn't leave, you know, they didn't finish when the family left the room. If anything, that's when the real work started. It was hours of writing, cross-checking information, piecing all the notes together late into the evening. It just wasn't sustainable. But we kept doing it because the reports are important and we feel that the family deserve our best. But it came at a cost to us and a cost to the service and actually to the next family who are waiting. But since Magic Notes, that burden is now lifted and our documentation, it happens within real time. Our assessments flow much more naturally. We leave the clinic on time. I shut my computer down. I'm not there, you know, with my kids nagging me, kind of trying to half type and do all of these different things. And when we leave the room, the report is almost ready. We're not chasing our tails. So that time then is being given back to the patients and to their families and to us. And it's created breathing space in a system then that kind of didn't have any and hopefully will make tangible difference then to waiting lists. But it's not just about saving time, it is about restoring hope. So hope for the families and actually yes, clinicians who kind of want to help them really. And I'm sorry I've chewed your ear off now for long enough. I'll let who's ever after me go.
Thank you, Penny. That was amazing. I'm sorry you're so tired after your activity this
Oh,
morning.
it's Sergeant. Honestly, I'm knackered.
Sinead, are you there?
I am. Hello.
Brilliant. Thank you. Off you go.
So yeah, a lot of what Penny has just said, I feel like I'm gonna repeat the same sort of thing. But it's just been fantastic. I think Penny said towards the end, you know, getting that breathing space back, that's been one of the biggest sort of changes, I think, for me personally. When parents, you know, they come into these appointments, they sometimes don't know what to expect. They've been waiting 2, 3, 4, maybe even 5 years to speak to someone. And they come down and they sit in front of you, and you're often like the first point of contact for some of these families. And they just offload so much emotion, so much worry, so much stress. And it's really difficult, like Penny said, like in those 90 minutes to have to, you want to listen to them, you want to be there for them, you want to support them, but we're also very aware that we've got 90 minutes to get through, you know, our list of questions that we need to ask. And that was something I really struggled with when I joined the team. I couldn't give that family my best because I was constantly overwhelmed, you know, trying to take in all of their emotions and feel all their emotions. It was really emotionally draining at the end of the day. You know, when you've got parents and patients and families back to back, that 90 minutes can just be full of, I've had, you know, we've had to stop the session because they're just completely overwhelmed themselves and they cry. And it's just a lot of emotion that we're all taking on. And as clinicians, we're really empathetic. So we definitely feel those emotions. And I was just finding by the time I got to the end of my day, I just needed 5 minutes to breathe. My head would be pounding. And then I'd be thinking, okay, I've got to get ready for the next family to come in. And then I've got to get ready for the next family to come in. And I just didn't have the headspace to write notes in the same day. It's completely impossible because I needed time myself to sort of decompress. you take that time to decompress, and then you're on to the next thing. You're on to your emails, you're on to your telephone calls, you're on to nursery pickup, you're home, you're cooking tea, and then again 10 o'clock at night you might think, right, I'll go back to this. And my life just felt chaotic. I think as jobs go, it's a very emotionally draining. Although we are giving families so much help and support, it does definitely take its toll, I think, emotionally on us. And I think since having Magic Notes, I didn't realise how much I was then just able to breathe that little bit more easily, having some of that cognitive load taken off. Some of my appointments now, whereas I've got the whole 90 minutes, they might finish within an hour. I've then got time to reflect on that session. I've got time to collect my thoughts. I've got time to read through the report and see if there's anything missing. I've got time to make a cup of tea. I can't tell you how great it is to have a cup of tea in a working day and not have to wait until you go home for your first cup of tea. So just having that time to breathe for myself, to reflect on what has happened, it makes me a better clinician, and it makes me more ready for the next family who comes in, because I haven't got the chaos and the noise in my head of the previous family and the worry of what am I going to put in that report? Have I made enough notes? Have I made enough observations? Which, like Penny said, I often haven't, because I'm too focused on, going through my questions and making sure I've covered everything. That key information, those observations, the real stuff, all that was missing from my reports. I just didn't have time or capacity to fit it in. And then you just carry that stress. You carry that stress when you go home and you think, oh, I've missed something. And you're not giving the family your best every single time. And, when I was preparing for this, I was looking at some of the health board's values, income TAF, and some of the values they talk about. When we are at our best, then the patient gets the best experience. And that's exactly how it should be. But for me personally, to be at my best, I need to feel calm. I need to feel like I can go in to each appointment with fresh eyes and ready to take on some of those, the feelings that parents are going to express. And Magic Notes kind of gives you that back. Penny said, really nicely about how you can just leave it to record. You can really connect with some of these families. And you can really connect with some of the young children. I find teenagers are teenagers, and they can be really difficult, and they have no interest in saying hello to you on the best days. So when you put them into a neurodevelopmental assessment, it can be really difficult. And there's been plenty of times where parents have come in and said, look, she doesn't talk to anyone, she hasn't spoke to anyone outside of our family. And by the end of that session, I'm having this lovely conversation with a teenage girl about some of her interests, whether it's Harry Potter or K-pop demon hunters or whatever it is. But parents are always just so surprised. And I've had a number of mums come back into the room and just say, that was brilliant. She hasn't opened up to anybody like that in years and years and years, since she was a child. And that has only been possible because of Magic Notes. So I can connect, I can sit there, I can listen to what that child is trying to tell me, I can listen to what their interests are, and we can connect on a deeper level, and they just get a much better sort of experience from it all. And I leave feeling like I've got the information I needed, I've got a real picture of that child, of that family, and I don't feel like I'm going home in a chaotic mess and burning my child's fish fingers every night.
Thank you, Sinead. That was amazing. Michaela.
Hello. My name is Michaela. I'm also an ND practitioner in Income TAF and have been trialing Magic Notes for the last couple of weeks. I'm really sorry. I'm just going to probably copy a lot of what Penny and Sinead have talked about already, but in a way, I think that's really positive because it shows that feedback is really consistent. And we've all kind of had the same experiences within our clinics. So I think that is a good thing in a way. But my section was kind of to talk about, what surprised us about Magic Notes. And I think, to be honest, Magic Notes continues to surprise us every day. We're continuously finding new uses for it, coming up with new ideas, just trying out things and being willing to try new things, which has been really positive. And I think the biggest surprise, and we've talked about a lot already, is just how we've been able to finish our appointments on time, or sometimes even early, which before Magic Notes was just pretty much unheard of. We've talked a lot about how detailed the assessments are. Parents come in with lots of expectations and information, that we want them to share, but we also have to complete very detailed assessments and observations to make sure that we're coming to the right conclusions and diagnoses for these young people. And so they are very, very important appointments. And a lot of the children that we see are very complex, and the hour and a half that we get for the appointments just sometimes isn't enough a lot of the time. And so I was thinking about, well, what happens if we don't get an appointment done on time? We can't just say, oh, that's fine, we'll just complete our report. We need that information to come to a conclusion, so that then infringes on our admin time or our personal time, having to arrange further follow-up phone calls, follow-up appointments to try and finish off that assessment and get all of the information that we need. And recently I managed to finish an autism and an ADHD assessment within 48 minutes, which was one of my personal bests. But, you have that instant panic almost, because you feel guilty. You think these families are allocated an hour and a half, and I immediately thought, well, we must have missed something, or we haven't gone into enough detail somewhere. But when I went back, had a look through my report, looked at the criteria, we had everything that we needed. I had done really detailed observations, and so I think that just really showed me how much time Magic Notes can save. I think a huge part of that reason is the engagement and the flow of the conversation. Again, we've talked about this loads already, but you're not handwriting notes, you're not stuck in your laptop, you're able to let families have that conversation, say what they want to say. You're not saying every 5 seconds, oh, hold on, I just need to write that down, I just need to catch up, or park that thought, we haven't come to that section yet. You can just let them lead that conversation, which feels much more genuine and much more comfortable for the parents, for what must be a very anxiety-inducing situation, which I think is a huge benefit of Magic Notes. But I think, again, something that we've already touched on, but employee well-being is just wrapped up within that. So on a Friday I've got a full clinic, so I've got 4 patients back to back. If you run over on any of those appointments, particularly your morning appointment, you're stressed from the very start of your day. If somebody turns up late, or if you run over time, because you can't just claw back that time from somewhere, because everyone generally uses up all of their appointments. So that runs into our lunch hour or our admin time, or a lot of us have young children. It means a late nursery pickup or a pick up from the childminder. It impacts on our daily personal life as well. So I think that's been a huge benefit of Magic Notes, is just how, and probably we didn't expect the impact on the appointment time, but also the impact on our well-being, which has been really, really positive. So yeah, that was it from me. Oh, and also just to say, so sorry, Kim, I know we've talked a lot about new patient appointments, but we have also used it for other functions. So things like triage, referrals, emails. I've used it for my school observations, and it's been absolutely brilliant. I can just take it out on the road with me, do my appointments in the car, do my reports, and there's been no difficulties with it there. It's been really, really helpful. So yeah, just trying to find other uses for it as well to make the most of it.
Brilliant. Thanks, Michaela. Charlotte?
Hi, can everyone hear me okay? Yeah, I think we just need to change the slide over, I think. Perfect. Right, so I am actually going to be coming at it from a little bit of a different perspective to what you've heard before. So just for a little bit of kind of background of my role in the ND service, just so you can get a bit of an understanding of what I do, because I'm a little bit different. So I'm a pharmacist by background, but I'm one of the non-medical prescribers for the team. And my usual kind of clinic is follow-up ADHD medication monitoring, and I tend to see 5 patients, 45-minute appointments in my clinic, and then I have the afternoons then. So I have a morning clinic and then afternoon session for admin. So you can imagine it is a bit of a difference in my kind of clinic setup versus what the girls have spoken about before, and those really impactful conversations about how much of a difference it's made and families feeling listened to and being able to engage more in the session. Mine are a little bit different. They come in, they've already had their diagnosis, they're coming in for medication monitoring, titration of medication. Sometimes I'm involved in the disclosure of ADHD diagnosis and come into conclusions about ADHD diagnosis as well. So I do have a bit of a mixed bag in my clinics. It's not the same every single day. And as part of my role as well, I also support some of our non-prescribers who also do clinics in our service. So we've got a healthcare support worker, Jamie, who does a medication monitoring clinic as well. We also have a pharmacy technician doing a similar role, and we also have some of our nurses who are currently undertaking their non-medical prescribing qualification that are also doing medication monitoring clinics. But obviously, because they're not yet prescribers, they can't make those clinical decisions in their appointments to kind of change medication, alter medication, start medication, you know, very knowledgeable professionals, but without that prescribing qualification and going through those prescribing rights, you can't necessarily make a decision without discussing it with one of our prescribers. So I do play that role as well. So I hope that's kind of given you a little bit of a picture that my days can be quite busy, and usually I would do 3 clinics a week, so I could see 15 patients myself a week, as well as supporting 4 other non-prescribers in our team on different days. That doesn't get really any particular allocated time, that just comes out of my admin time, that eats into my admin time. So what I wanted to reflect on, and just so you guys know as well, I was the person who said that 3 days in, if we don't get it, I might quit my job, because it made such a massive difference, particularly on my well-being, and feeling that I had the time to breathe, and not just the time to breathe myself, but also to be able to think and give my clinical opinion to our non-prescribers, and give them the time that they need to be able to address the problems that they've come across in their clinics, and make sure that all issues and queries are resolved in a timely manner, and that families aren't waiting to hear back from a clinician. We can do it really quickly. And you know, in my clinics, I see so many patients through the week. It is so hard sometimes to remember who said what, who needed this, what parent reported this symptom, and trying to remember and differentiate and making sure that the documentation is really thorough and accurate becomes really challenging when they are so quick turnover, and it can be really emotionally draining as well, and sitting and typing those reports can be quite challenging. After a full day, you've been quite frazzled in a clinic appointment, then having to discuss cases, and then sitting thinking, oh God, I'm going to have to type 5 reports here now, and kind of having a bit of a block. But it completely removes all of that stress, because I know that Magic Note is doing a job in the background. It's recording all of the observations for me. It's recording and summarising the discussion that I have in clinic, and it's making a really accurate, and to be honest, a lot more detailed than what I would write myself, report of what happened in the clinic. So it has helped massively. And what I wanted to highlight is even saving 10 minutes saves 10 minutes. And I think the main kind of outcome and the main positive benefit I've seen is that it's massively reduced my cognitive workload, because I had quite, sorry, the prescription printer's right next to me, so you might be able to hear that. Wait for it to finish. Yeah, I had quite a big cognitive burden. I'm not just thinking about the patients that I had to see, but also supporting, making decisions about other patients as well. And that has completely removed that cognitive burden of thinking about what I needed to write for who, boom, 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 and trying to keep on top of my workload. It could be quite stressful, so it's completely removed that stress. And I found within the clinic appointment itself, I didn't think when I started the pilot that it would have much of a difference on my clinics, because they are so fast-paced in comparison to the initials. But even having that 5 minutes of not having to sit on my laptop and documenting everything I hear during the appointment, to really think and listen to what the family and the patient is saying to me, and to have that time to make that clinical decision without having to worry about, oh, I need to write this down, I need to write this down, I need to write this clinical observation down, I need to write this phrase that was said verbatim in my letter. It actually allows me that time to really stop and think, okay, what can I do about medication? How can I support this child and this family? And what can I do to support them and them feel a lot more engaged and listened to during the session? So yeah, I've only got praise for it, to be honest. It's made a massive, massive difference to our workload. And hopefully we'll be able to carry on using it post the pilot, fingers crossed.
Thanks, Charlotte. Yeah, so every time we hear this team talk, we're just really reminded about why this work matters so much. You know, they've all said it, it's not about technology, it's about time back. That's time with families, time to think and time to breathe. And about a week ago, we had a moment that I don't think Dave or I will ever forget. Dave showed Kath Bowen, who is the team lead from CumTAF, a dashboard with some projected time savings. And they're based directly on the diary studies from her team, and she burst into tears. Now, Kath is on holiday now, and I've definitely checked with her that it's okay to share this story. But she just said, you know, I just never cry, but this just feels like years of worry, and that there might be a way forward and there might be some hope. That sounds really powerful, doesn't it? And Dave and I definitely feel this emotion too. I think anybody who's been part of this work really shares that feeling, that the sense of hope that it can possibly bring. So here's the challenge now. How do we get through with being able to focus on reducing the waiting list, but also not losing anything that we've heard today in terms of, you know, all the learnings from the pilot? And how do we find that sweet spot in between, so that point where we can protect the quality of care that the team feel now that they're able to give, but also we're moving through that waiting list? So want to talk a little bit about what it means in practice. So we're going to drop back into the data now. The next few slides are all about what we've learned so far. We've been focusing on one experiment in particular, which is the new patient assessment. And this is the one that effectively removes the child from that waiting list into the service. But definitely remember that this isn't all of the impact of the scribe, it's just one part of it. So right now, without any change, that waiting list is going to keep growing at about 100 more children every month. So by 2027, that would mean nearly 5,500 children on the waiting list. But with an AI scribe, we think we can probably start to turn that around. So the data tells us that we could save maybe half of the time per new assessment. So what that means is it's a shorter assessment, because as we've heard, the clinician isn't just typing at the same time, and they can actually focus on the patient, and it's a shorter writing up time afterwards. The diary studies also tell us that the team think this product is really easy to use, and that the quality of what they're producing is also really excellent. And in our mid-pilot interviews with the team, we asked them to describe Magic Notes in one word, and I'll just let you read those yourselves. So we've looked really closely at the data and what it might mean to the waiting list. So if, for example, 4 more children per clinician are seen a week, the waiting list will be cleared in about 2 years. So it might look something like that. And then in terms of cost, so this is an approximate figure, but using Magic Notes as an AI scribe, it could cost between 30 and 45,000 to clear that list. So, you know, that cost doesn't really feel out of the question, but it's important that we think about that sweet spot that we mentioned earlier. That's that balance between protecting everything we've heard from the team, as well as getting more children seen sooner. And when we think about rollout, we need to think about exactly where that sweet spot lies. We think there's some other things to think about too. You know, if you can imagine life as that waiting list is coming down, lots of things will be positively impacted, because with a really long waiting list, there's also lots of additional time needed. Contacting families to update any details, rereading old notes, always refamiliarizing yourself with what's been going on. updating any expired consent or background forms, and managing any cancellations as a result of that really long wait, and ultimately potentially responding to complaints and any waiting list inquiries. And all of these things might slowly drop away. So from our perspective, Dave and I and CDPS, this is what we're building towards now, is a future service, so real transformation, so where clinicians aren't stretched to the limit and families aren't waiting years. And at the beginning of this work, as Dave said earlier, we created a service map showing everything that happens along the journey, and we really want to create a new version of that, pulling together everything we've learned and all these really incredible ideas and all the innovation coming from the team. There's just so much more to come. We want to really try and answer some questions around what happens if the admin happens more quickly. Can it help with building stronger links across different departments and services? Ultimately, what could that better connected future service really look like? And we are hoping a second pilot in Haldar to really help us with some more rich information. That's a different setup, slightly different processes and different people to learn from. So that's what we're really looking forward to doing next. So what next? How can we make this stick? Because what we've seen in CumTAF, it just can't end. The risk is greater if we do nothing. You know, we talk about risk an awful lot. And yeah, we do really have to be careful with all of this because it's so new. But already there is clinical risk in the way that things are working now. Our clinicians, you heard them talk about they're pretty exhausted. The notes are piling up and the families are waiting. And we've already seen how the scribe can make a difference to that. So the AI scribe in our testing has heard stuff over and above what the team have heard. And equally, the team are now in turn being able to sit on the floor and play Connect 4 rather than typing. So, you know, it's a win-win. We really have to get through any barriers to this work, whatever it takes. You know, the team are ready, the tech is ready. We just really need permission to carry on. Needs to happen now. Every child added to that waiting list will wait longer than the last. And this month alone, that's another 100 children added to the waiting list in CumTAF. And if we think about the costs, you know, the license, the setup, and weighing it against the cost of not acting, it really doesn't compare. So how can we not invest in something that's going to really help in all the ways that we've described today? Pulling on all the heartstrings now. So, you know, we all want it. I don't know how you could listen to what you've just heard today in the show and tell and not really want it, but wanting it is enough. We really isn't enough. We really have to try and make this happen in a short time scale. You know, from our experiences, transformation can take a real lot of time, and we do know that there's loads of work happening around Wales and the use of AI, and we really don't want to slow down though. And, you know, we want to build on the success of these pilots at a low cost while this bigger picture continues to emerge in the background. So for everyone that's on this show and tell today, if you think you can help us with what might get in our way, then definitely please get in touch. And yeah, you know, so when Dave and I working on this show and tell, the importance of how we tell this story really wasn't lost on us. We're right at the start, but the difference that this AI scribe can make is really immeasurable to this team. We hope we've done justice to them in telling the story with them, and in turn to all those children and families that they're working so hard to support. So we think we've got the evidence, we've got the story, and we're going to have a really good roadmap for change. We just need someone to help us push it forward at pace. And that is it. Are there any questions? Conscious we've only got 5 minutes actually. Any questions? I can't see. Elise, can you see the chat?
Yeah, I can see the chat, just having a quick look through. I think Carolyn's got her hand raised while I just see if there's any in the chat.
I thought that was really informative, and you can't argue, can you, with the feedback? But so when we go to request anything that includes a cash cost, and it's an ongoing revenue cost, you can probably understand, particularly with financial concerns around covering pay rises and everything else in this year's funding allocation coming up. So what we need is a really good benefits plan that, whilst it is about reducing the waiting list and these points, we do need to then equate that time. So the efficiencies that you mentioned, perhaps if they were allocating over time, you know, how does that reduce those costs? So it's about making sure that we can get the 30k to stack up. I know that sounds like a cold-hearted view of it, but I'm just telling you that is what will happen when it goes to our Zach and our financial control group. And I want to be able to support our teams with this because I think it sounds fantastic. That's the sort of thing that would be really, really helpful, is coming up with a benefits plan matrix that the other health boards can then use to then help build up their picture to try and support this decision.
Yeah, brilliant. It's a really good point, and we hope that we'll have that by the end of the pilot. We have got such a lot of rich data, so I feel like it's something we can definitely do. Charlotte, did you want to come in?
Yeah, I was just going to add to that, like, because Magic Notes does a lot of the typing, it depends on how it works in your health boards. But if you have clinicians that have clerical staff to do typing, if you're then the clinicians can kind of read their own AI scribe notes, that kind of frees up that time that clerical staff would be using for typing, which would then kind of free up that money and free up their time to do other tasks. I suppose there's just ways and means of looking around it, because I know a lot of us do our own typing, but we still have some of the paediatricians that rely on clerical staff to do the typing for them. So, you know, there are ways and innovative ways to think about how Magic Notes would benefit from that perspective as well.
Sue, do you want to come in?
Yeah, I just wanted to reiterate, we also do not have enough admin support to do any of our admin. So actually a lot of the time is spent by clinicians carrying out admin tasks. So having this this Magic Notes is just going to be an absolute game changer for us in so many ways, and the team in CumTAF have been brilliant in just giving the feedback and how positive it is. We're really excited to get going on the pilot. We really cannot wait, and hope that happens shortly. And I know we've got to get templates to you, but yeah, just to say to Carolyn, we'll do all we can that is required for a matrix for you to try and get this, because I think it's going to, you know, the money will be absolutely well spent, and it's going to make great grounds through our waiting list. So just wanted to say that, really.
Thanks, Sue. Sunil?
Oh, hi, good afternoon, everyone. I'm Dr. Palapak. I'm one of the clinical leads in the CumTAF. You heard all my colleagues basically speaking their views. I just want to add and echo everything what they said. Forget about the management, forget about everything else. Clinically, yes, they got their views. We are also a university hospital, so perhaps it's easier for us to concentrate on the trainees, the students who come to us as well. This will definitely give us some time to spend time with them, being in a teaching hospital like this. So when we are in a clinic, obviously this magic will definitely do a magic for us. Honestly, I'm telling you. So I'm in support with that. If the management could think about being this pilot, transforming it to be in a real life, it'll be really appreciated. Thanks a lot.
Brilliant, thank you. Anybody else?
We've got a couple of questions in the chat, Kim. We had one from Emma, which was about any pushback from a GDPR perspective about using it.
Hi, sorry, just to jump in on that one quickly. I think Sue from Swansea's kind of covered the broader point that I wanted to make, really, in terms of, you know, it's excellent that this is being kind of launched at the moment in different areas. You know, it must be really exciting for Hywel now to be able to kind of take on this now as a pilot. But if this is working so well, and it's quite apparent it is, why aren't we doing it regionally or nationally at this point? And like, what are the barriers realistically at the moment, and how would you be able to kind of overcome them, really? That's the broader sense. I know there's a financial implication, but obviously if you're spending all this money on private providers anyway, you might as well be doing this. I guess that my question really kind of related to the confidentiality issues around it, and I guess that was just one point off the top of my head, that in terms of resistance that we might get to this, but overcoming it just in generally, because this sounds brilliant, it really does, and there's a sense of excitement from me hearing all this, but also that inevitable frustration that this is probably going to hit so many barriers. And what the question kind of relates to is, how do we overcome those barriers together to make sure that this gets implemented nationally?
Yeah, good question. Sean.
Bit of a loaded question, sorry.
Yeah. Sean or Sally, do you want to come in on the thoughts about the national programme? Are you still there?
Yes, I'm still here. Yeah. Hi, Kim. I think Sean's already left for another call. Just to say that, we are working with CDPS to take forward the pilot in Hal Dda, and we had a meeting yesterday to discuss that, but also around, looking at that end-to-end process in the use of AI scribes, not only Magic Notes, but other ones that could be useful in this context. And then thinking about, so what does a national sort of supplier framework look like, but also minimum standards for the use of AI scribes. So those are all the things that we're going to be looking at between now and the end of March, and then consider how we can take this forward on an all-Wales basis.
Thank you. I think we've still got a couple of hands up. I can't see Charlotte. Charlotte, is that a legacy hand?
Oh no, I was just going to add in terms of consent and GDPR, we've gained consent at every appointment to use the Magic Notes tool, and I haven't experienced one family that have denied consent to use it. Everyone, once we explain that we're doing a pilot and it's all gone through the health board checks, it's to help with writing our clinical letters, which will therefore free up clinician time to see more patients. Every single family I've spoken to in my experience so far of using Magic Notes has been happy for us to use it, and have been quite interested actually in that we're using different digital technologies to help with our appointments. So I've been faced with only positive kind of feedback and opinions from families when using it in a clinic-based situation, and I haven't had a single family. I mean, we've only been using it for 3 weeks, so the likelihood is at some point there's going to be somebody who doesn't want us to use it. I understand that, but I was quite surprised that everyone was quite happy to use it when I've been speaking to them and explaining what we're using it for. So I think sometimes we can be very cautious, can't we? But I think a lot of families are quite keen for us to use different technologies to make everyone's lives easier, and to make the process for families as well, and during that appointment to feel that they're getting listened to, and rather than sitting in front of a clinician who's typing aggressively on a laptop to make sure everything's written down.
Monica?
Thank you. I just wanted to, because actually that in Havildar, that ADHD service is not under NDT. Is this Magic piloting only for autism service in Havildar? Or we have not been informed regarding this one, that's all.
Oh, so I would need to double check with Sue. Are you on the call still?
Yes, I am. Yeah, just turning up. Yeah, yes, I am.
Do you want to speak about what the intention is for the pilot?
I think because it was a very small pilot and it was only going to be targeted at just a number of clinicians within our service to look at the benefits, because we have to cluster benefit. So at the moment it is only being piloted within the ASD service. Moving forward, it's hoped that we're going to roll it out to other services as well, and that would include ADHD, it would include adult ADHD and adult ASD. But at the moment, I think because of the implications of looking at the positive benefit of it, it was a very small study at the moment, and we're hoping it will replicate come TAF. So yeah, that's my understanding.
Okay, thank you.
I think, well, we're 5 minutes over, aren't we? So, and I don't think there are any more questions. So thanks everyone for coming, and see you all at the next one.
Bye bye.
Thank you, Kim. Thank you.